Following the disclosure of information on the death of 3 babies at the General Hospital on Tuesday, Minister of Health Nickolas Steele announced last Thursday that there has been conflicting reports and that an investigation was launched to ascertain the facts. The finding of the report is yet to be made public, as the minister says it must first be presented to Cabinet, which met on Monday. However, the National Democratic Congress believes the minister did not follow the proper procedures or conduct what is termed basic investigations before making such pronouncements.
The minister should receive information like what he received last week, should come from the CMO directly. And I do not think it came from the CMO, seeing that the CMO did not have that information.
With regards to the investigation, caretaker for St. George Northwest, Ali Dowden, hopes the minister follows the proper procedures.
I urge the minister to sit down and take some time and study the laws that governs the health sector. The Grenada Hospitals Authority Act 130A, the Medical Practitioners Act 132A, the Medical Officers Act Cap 188, and I'll be happy to point the minister to any other relevant acts which govern the health sector in case he needs that. Another one would be the Private Hospital and Nursing Homes Act Cap 254A. These are some critical pieces of legislation that the Minister of Health needs to take a look at if he seriously intends to address the issues in the health sector.
The St. George Northwest caretaker pointed to several pieces of legislation that will guide the minister's action in dealing with the matter. Dowden says based on the information they have gathered, none of the deaths mentioned by the minister actually took place at the General Hospital.
What took place was what we consider a case, which came from the community, an abortion of twins, 4 months, which is not necessarily considered a birth in medical sense, and 1 premature baby. And so we're not sure where the minister got this sort of information from.
Meanwhile, Minister Steele, during his last interview with GBN, says the reports, whether conflicting or not, should serve as a wake-up call for all concerned to improve on the services provided through Grenada's healthcare system.
We use what the reports that came out as an opportunity for us to better ourselves. Whether those reports prove to be of the level, whether it was 1, 2, 3, or even more, we use this opportunity to put the necessary measures in place to make sure that there is that trust between the public and the healthcare providers.
Akisha Felix for GBN News.